change in our caregiving. So with that said, keep those things in mind. And I would like to shift now to why we're all here, and that is to hear from Harold Morales, who is the new community program specialist at the Alzheimer's Association Heart of America chapter, my old stomping grounds. Harold, on the webinar last week, I was the speaker, I and another colleague, Melissa, and I was talking about how once upon a time I had worked for the Alzheimer's Association. And I told the group that the Alzheimer's Association strategy is apparently to find really cool people from Los Angeles and convince them to move to Kansas City to work in Alzheimer's care and research. So far, so good. They've gotten at least two of us. I'm going to tell you all more about Harold. He is a passionate public health professional with experience in both the nonprofit sector and vector ecology. He has worked to develop strategies that address health disparities in low-income communities in both Kansas City and Los Angeles. He earned a Master of Public Health, Health Promotion and Disease Prevention from California State University, Fullerton, and a bachelor's degree in agricultural biology from California State Polytechnic University in Pomona. Harold is really excited to have started his new position with the Alzheimer's Association, and he has a focus on diversity, equity, and inclusion, which we all know is really special and really important. Harold is a Spanish speaker. And he's thankful for the opportunity, looks forward to making an impact within communities that are disproportionately impacted by this terrible disease. So with that said, Harold, I will turn it over to you with my great thanks for your being here today.
Well, thank you for the introduction. That was really flattering. Hopefully I can deliver.
Yes.
And let me start by sharing the screen. I suppose I do have a PowerPoint. You
should be able to share your screen now.
Okay, I see it.
You are a co-host, so you have all the power.
All right. And you can see okay, are you able to see the presentation?
Yep.
Yes, let me get rid of that. Okay. Perfect. Well, welcome everybody. Thank you so much for the invitation, for having me here and giving me the opportunity to come and speak today about the Alzheimer's Association and about the different programs and resources that we have to offer the community. As Kelly so graciously introduced me, my name is Harold Morales. I am the Community Program Specialist with Diversity, Equity, and Inclusion focus. And I am, as of yesterday, I've been employed with the Alzheimer's Association for a whole month. So you are my first group of audience, and I thank you for that. And well, let's get started. Well, and that's okay, there you go. So a lot of times when we talk about Alzheimer's and dementia, we use the words interchangeably to mean the same thing. But in most of the time, we use the word dementia to mean sort of like an umbrella term, if you will, to describe a wide range of symptoms that are associated with cognitive impairment. Many of the symptoms are for example, the most common ones are problems with short-term memory, forgetting to pay a bill, or perhaps planning, challenges with planning or prepping for meals, or remembering an appointment. There are multiple causes of dementia. As you can see on the graph, the number one cause of dementia is Alzheimer's disease, which accounts for 60 to 80% of the cases for dementia, followed by the vascular dementia, and those are between 10 and 40% of the cases. Lewy body dementia on third place with 10 to 25% of the cases, and frontotemporal dementia making less than 10% of the cases. So Alzheimer's is a type of dementia, that in fact, the number one type of dementia. There are specific characteristics when we talked about Alzheimer's disease, and I would like to highlight that Alzheimer's is not a normal part of aging. The changes in the brain that goes through a patient with Alzheimer's include accumulation of proteins, and actually this is the hallmark of the disease, or one of the main features of the disease is this type of accumulations that happen in the brain. This is caused by two types of protein. We have beta amyloid, which causes plaques to form in the brain, and then tau protein, which causes a sort of like twisted strands or tangles to accumulate in the brain. These proteins accumulations, when they start happening, they're the causes for the death of neurons to happen in the brain, which contributes to the ability of the person to remember. We often want to bring awareness to 10 early warning signs of Alzheimer's, and some of which are changes in mood, withdrawal from work or social events, perhaps an increase in poor judgment, misplacing things like your wallet, your keys, memory loss. But all of these 10 warning signs, keep in mind that they are disrupted enough for the daily life of the person. They're severe signs, so they're not to be confused with the normal sign or normal part of aging, which we all experience. Forgetting the name of a person, or forgetting occasionally miss an appointment, or we don't know like the day of the we get confused on the day of the week that we're in. So those are normal part of aging, and they're of aging. And so not to be confused with these signs. Again, these are severe signs, and they're it's important to notice them. And if you notice them on yourself or a family member, it's also important to not ignore them, to seek medical help if you notice any of these signs. When we looked at the statistics for Alzheimer's, they're pretty staggering. They're overwhelmingly. These are national statistics for the United States. There's an estimated 6.7 million Americans living with Alzheimer's, of which 1 million of them are actually living alone at home without any caregivers. So that's pretty scary. Also, we see that Alzheimer's kills more people than breast cancer and prostate cancer combined. 1 in 3 seniors living with Alzheimer's, or kills 1 in 3 seniors with Alzheimer's or other related dementia. Since between 2000 and 2019, we have seen an increase of Alzheimer's death of 145%. So those numbers are pretty eye-opening. While other diseases have decreased, the death of heart diseases have actually gone down. And all of these statistics are only supposed to increase. They're only supposed to get worse. We see that the number of Americans living with Alzheimer's is expected to double by the year 2015. So moving on to the state-specific Kansas and Missouri statistics, we see that in 2021, the number of adults 65 and older living with Alzheimer's in Kansas was 55,000. In Missouri, that number was 120,000. Both Alzheimer's is the number 6 leading cause of death in both Kansas and Missouri. So again, the estimate of Alzheimer's, of people with Alzheimer's, only supposed to increase by the year 2025, as you can see in the chart. Alzheimer's is not only a public health crisis, but it's also a financial crisis as well. As we can see that Kansas and Missouri combined had 312,000 caregivers that were providing unpaid services. So it's a pretty financial burden for the families. Alzheimer's is a devastating disease, not only for the families, but the patients, the caregivers and the families, but also the community as a whole. And that is why organizations as the Alzheimer's Association and KU Alzheimer's Research Center, we have, both agencies have a common goal, and that is to eliminate the Alzheimer's through treatment and prevention. And that's at the Alzheimer's Association, we have a vision of a world without Alzheimer's and a mission to end Alzheimer's by contributing to global research, risk reduction, and early detection. We see that in both organizations, there is an overlap in services and education, which is great, because when we see the statistics and we see the numbers, there are really these are only the tip of the iceberg. The numbers are overwhelmingly, and they're only expected to double or even triple in some areas. So there is a need for services in education, and the more services in more organizations that provide the services in education, the better. There's definitely a need in the community. But we also see that both organizations focus on different areas. So the Alzheimer's Association focuses more on education and providing services to the community, whether KU Research Center focuses more on the research aspect of the disease and involving getting participants from the communities and getting them involved in research opportunities. There are also areas where we complement each other, we collaborate, and one of the ones that comes to mind is collaborating towards the outreach out of underserved communities, the Latino communities. That's one area where we often collaborate with each other. The Alzheimer's Association was founded in 1980 by a group of volunteers that even in the 80s, they saw the need for services in the community. And since then, volunteers have really been a focus or at the core of their organization. The Alzheimer's Association is a leading volunteer organization in the country. It has chapters all over through the entire country. Here in Kansas City, we are in the Heart of America chapter, and we have an office in the main headquarters is in Chicago, and we have a public policy office in Washington, D.C. So as I mentioned, we are in the heart of America. We provide service to 65 counties, in both Kansas and Missouri. And the areas of focus, there's 5 main areas of focus that we provide service in. And those are really the pillars, the foundation of our services. We provide care and support, awareness, advocacy, and research. I stated that we don't do research, but we provide the funds for in the form of grant programs and partnering with other organizations to provide those fundings so they can research can be conducted. As you can see in the total annual expenses on the top right, the 79% of those expenses went to supporting those 5 areas of services, while 17% went for fundraising, which I will talk to about later in the presentation, and the remaining 4% were for administrative expenses. So one, just highlighting the main programs that we have in care and support. We have the helpline, which is a great program. It is a line that is open 24/7. You can call obviously at any time. It's staffed by master level clinicians that have gone through excessive training and could answer most the 99%, I would say, of the topics, like whether it be if you're seeking for a resource or need a doctor's connect with a support group. So there's several if you need tips or coming up with a plan, so they can help you in whatever it is that you're needing at the time. It has over 200 languages. We also provide a variety of support groups, and those are either virtual or in person. And the aim of those are to empower and inform the caregivers and patients. When it comes to educational programs, I mentioned that we are the largest volunteer organization in the United States. So we do train volunteers. We rely on those volunteers to go out and raise awareness in the community, to become facilitators of the support groups, to educate, to be community educators, community representatives, to advocate, to become advocators, and even promotores, which is a community health worker in the Latino community, sort of like a liaison type of role. So we rely on them, especially when it comes to like rural areas where we might not have enough representation or enough medical staff to be available. So we heavily relied on those volunteers to go out in the communities. Other educational programs, we have a lot of courses and trainings, workshop style trainings that we do for the general public, and that could be individual, an organization, or a business. Those are done in person or online at your own pace, and we cover different topics. So you can see that I highlighted some of them on the right side. We talked about financial matters, like managing money for caregivers. How do you affect the communications? How do you communicate with your loved one that has Alzheimer's? Or how do you manage the communication when the interaction of the public when they go out to the stores, for example? The 10 warning signs, which I briefly mentioned before. So we have a whole course on that, understanding Alzheimer's versus dementia, and there's several others that we have that you can sign up and do those. And again, we have another side of the educational program, which is the professional groups, and those are done by staff, and they're more detailed, more specific to the medical community, whether it be doctors, nurses. We just recently completed a training for 900 EMTs. So yeah, those are more specific courses for medical professionals. When it comes to clinical services, we do have, we provide a lot of clinical services. And again, that's done by qualified professionals that have a bachelor's or master's degrees, and they provide care consultation. That could look like emotional support, or perhaps a family wanting to have a customized action plan, whether a family member needs to be on a exercise routine. So they can guide you on that and come up with an action plan. Early stages support services, and doing screenings like 88 dementia screenings. And again, this is not a it's important to mention, it's not a diagnosis, but it's more of a baseline of where the person might be at a specific time. Another way, that one of the biggest way that the association fights against Alzheimer's is by providing public advocacy, and that is training volunteers to be public advocates and go out and persuade policymakers in order for them to increase research funds and have passed bipartisan legislation, perhaps making medication more accessible to the community, advocating for elders' rights. So it's a very big program, or will be a very big part of what the other organization does, just advocating for the rights of families and patients. There are a couple of programs that empower volunteers, and they could be, they go through different trainings. There could be an Alzheimer's ambassador or an Alzheimer's congressional team. or Alzheimer's state champion. So any of those trainings are available. And as I mentioned, I am the Diversity, Equity, and Inclusion program. The Alzheimer's Association is very committed to providing the resources and programs in awareness of the underserved communities. As we see, there is, I went over the statistics in general for Alzheimer's, but when we look at the diverse communities, they are severely underrepresented in studies or in resources available. We see, for example, that 2/3 or 66% of Americans living with Alzheimer's are women. There are also 60% of the of women are also the caregivers. So it's a group that's highly impacted by Alzheimer's. Along with the African American community, they're twice as likely as to have Alzheimer's. The Latino community are 1.5 times as likely to have Alzheimer's, and Native American community will have 4 times as more Alzheimer's, people living with Alzheimer's by the year 2060. So all these communities are severely impacted, and the Alzheimer's Association is committed to improving and providing services, reaching out to those communities that are severely underrepresented. I mentioned fundraising. So we are highly dependent on donations. We are a nonprofit agency, so we depend on all those fundraising activities. And there are 2 main ones. So one is the longest day. And I believe the longest day is June 21st, is the summer solstice. So that's when that's when that event happens, and you can sign up to provide any type of fundraising events. It could be, for the longest day, it could be a bake sale, a cookie sale, lemonade stand, whatever you want it to be. However you choose to raise funds. And the second biggest fundraiser, or the biggest, it would be the walk to end Alzheimer's. So that is being held on October 7th, Saturday. And that is another way you raise funds. You register online for both events, and they give you a website, and you can see the progress of all your how many funds you're raising, and what and connect with other groups as well. So those are the big 2 fundraising activities that we have. And just to quickly highlight some of the online tools, if you go to the Alzheimer's Association, you can find many resources, tips, literature, videos, trainings that I mentioned. You can sign up for those. There's also other online tools such as Alzheimer's Connect, which connects you to other groups, other people, and gives you tips. Alzheimer's Navigators, it gives you an opportunity to come up with build your own action plan. We have a matching trial where we go match the individual to all these different research studies that are going on. In just a general community resource finder where you can put in your information, your zip code, and it matches to your local program. There's also another one that I just learned about, the Wandering Response Services, and that's a collaboration with the Medical Alert Foundation, and you partner up with them. That, I believe, they charge a membership plan, and they buy a bracelet, and they kind of helps you monitor your loved one that's suffering from Alzheimer's, from preventing them from walking out. So there's a lot of resources available on their website, a lot of opportunities for you to sign up. Again, just to briefly recap the helpline, the 1-800 number. It's very helpful in a lot of free education materials, Alzheimer's.org, and community resource finder. So there's a lot of resources available for you either at the Alzheimer's Association or at KU. Again, we're always looking for volunteers. You can volunteer in however you want. You don't have to go through a specific training to become a facilitator. You can volunteer at an event or by entering data or however you feel comfortable in volunteering. However you feel like you can make a difference, you're more than welcome to join us and help us to fight against Alzheimer's. And that reached the end of the presentation. If you have any questions, I'm more than happy to answer them. And if I don't know the answer, I will get one for you.
Awesome. Thank you, Harold. There is a question in the chat from Susan. And Susan asks, what is the best way for someone concerned about their brain health and memory to get recommendations for a good neurologist, especially one without a long wait time for an appointment?
Yeah, I would say utilize the you can call or local office directly, and we can connect you to a person, or you can utilize the online service where we have the resource finder, so we can connect you to different. We have a list of neurologists and doctors, and that we can definitely like look and see explore what the options are, and see which one could has the quickest turnaround time, where you can be seen the fastest. So you can, and I should have put in her phone number. I can make that available somehow to you. You can always check out the Alzheimer's Association. That will connect you to the local chapter, or I could get the phone number somehow.
Harold, I think your local office phone number probably hasn't changed.
No,
I'll put it in the chat. I have it up here.
Oh, thank you.
I will also add to Harold's answer that participating in research is one way to get connected to some information about your brain health. And if you have memory concerns, we have at the ADRC about 30 studies happening, both for people with an impairment or with a diagnosis of memory loss and those who don't have that diagnosis. And those can be one way to participate in research that will give you a glimpse about what's going on with your brain, and to be able to talk with some professionals as you wait to maybe talk with a neurologist or a geriatric physician. So that's one suggestion. If you are a Medicare beneficiary, the Medicare website does have a physician finder, and you can use that to locate someone who is accepting new patients, for example. Sorry, go ahead, Harold, and I'll put that phone number in the chat.
No, I was just gonna add, would it be possible also to, I don't know if they've done ADH screening, and you can start that way. It like I mentioned, it's not a diagnosis, but at least gives you a baseline while we go try to find a doctor as well.
Yes, perfect. And there is another question, Harold, I don't want to miss it, from Carol. Carol is wondering if the Alzheimer's Association has worked with Bishop Spencer, Kingswood, or Lakeview Village residents or patients.
I would be the wrong person to answer that, because I just started, and that one of the names does sound familiar. I know they do work with a lot of residences office. So yeah, let me write the name down, and I believe, yeah, like I said, one of the names definitely sounds familiar. So I believe they have.
Yeah, I think so, Harold.
Yeah.
I'm pretty sure all of those facilities are care facilities with memory care
Mhm.
support. And I can tell you for sure that the association has certainly done education programming for residents, for family caregivers, and for professional caregivers. And I think would be willing to have a conversation with anyone who lives there, works there, knows someone who lives there about ways that they can be supportive. And I'll say the same thing is true for the ADRC.
Mhm.
And so speaking of that, I wanted to make sure everybody knows that one reason I wanted Harold to come on and be our webinar speaker sometime, and he was so gracious on accepting the very first time I asked with no hesitation whatsoever, is that I think the Alzheimer's Association and the ADRC are two really well-kept secrets in Kansas City. I can't tell you how many times I've heard people say, "Oh, I wish I had known about you sooner," or "How long have you been there?" And they passed by the corner of 75th and Mission all the time and had no idea there was an Alzheimer's Association there. And they passed by our office on Shawnee Mission Parkway and they have no idea of all the magic that's going on in here. And so we're really happy to share with you that you have so many resources. There's no such thing as too much information and too much support connected to a dementia diagnosis. And so we're so happy that Harold is on board. I'm especially happy that Harold is on board, my California homeboy. And also because, as Harold mentioned, his focus is on diversity, equity, and inclusion. And as you could see from his presentation, we have some populations that are at higher risk for lots of reasons of getting Alzheimer's disease. And everyone who has a brain is at risk. And so we want to make sure you have the information that you need to get all the support that you need. Elaine Dale, I see your question is, what are the speaking symptoms? Are you talking about when people might have trouble with language, whether that can be a sign of dementia? I think that might be what you mean.
Was that part of the 10 warning signs or well it's yes,
Elaine says yes.
yes, okay. So it's of course it's like again you have to differentiate between the normal aging, you know, type of thing that they can't find a word for a certain thing. But with Alzheimer's warning signs, it's more pronounced, it's more devastating. So it's uh problems with finding the word to writing, and it's something that you see more pronounced. And you can find more information on the like with details. I just put a like brief description of the 10 warning signs, but we have like a more in-depth and details information about that. So it's something that it's again more that affects the daily life of the person. So it's definitely you can tell the difference between just a normal memory loss for the moment that occasionally happens versus like the 10 warning signs.
Okay. I saw a question from Susan in the chat. I was typing, but I can go ahead and respond to it. Susan is asking about the AD8, as in the number 8, Susan, not the letter H, the AD8 screening and where you can have that done. And lots of clinicians can provide that. Your primary care physician, a neurologist, a geriatric physician, a neuropsychologist, a licensed clinical social worker. And so you've got lots of options for having that. I'm not telling you that you can Google to see what some of the questions are on the AD8. I'm not telling you to do that, but it is possible if you want to have an idea, especially if you are a family caregiver for someone with Alzheimer's disease. Family reporting is so important in diagnosing Alzheimer's disease, having somebody else to point out changes that they've noticed. So that would be a good tool. And then Harold, Susan also is asking in the chat, is that the same as the test that asked you to draw a clock and remember the words? And that's the mini mental state exam. So those, it's different from the AD8, but also can be administered by a healthcare professional.
I'm actually going through the process of getting ADH trained, so I'm not yet, but
Okay.
I will be soon. So
Okay. So Harold is yet another resource for you. Perfect. But I mean, even though you can Google and find lots of great information online, don't diagnose yourself because of that, with Dr. Google. Dr. Google is unlicensed and uncredentialed. Please talk to someone with expertise in dementia, like someone here at the ADRC and or someone at the Alzheimer's Association. Okay. I think we got all the questions in the chat, Harold. Is there anything else anybody needs to know or ask? Please do that. Next week, we will be back with you, same time, 2 o'clock on Thursday afternoon, and our speaker will be Mr. Ed Newsom, who is a caregiver for his adult son with Down syndrome, and he is working on a book about that experience. I met him at a parade this spring, and he told me about his adventures in caregiving, particularly with an adult son with a Down syndrome diagnosis, and I thought that that would be something really helpful and educational for us to hear. So he will be our speaker for next Thursday, 2 o'clock. You'll get the information in your My Alliance email. And yes, I'll give you one more reminder that this afternoon, the family series is at 4 o'clock at our office on Shawnee Mission Parkway. You can park right out front of the building, come inside to the Fairway Auditorium, first door on your left. I will be there waiting for you, and I have a sign so you can't miss it. We'll talk about a lot of the things Harold told us today, so thank you for the refresher, Harold. And we will talk about sort of how Alzheimer's disease works in an hour and a half. It'll be really as in-depth as we can get in that amount of time, and we encourage you to ask questions and take notes. I have a PowerPoint, which I will share with you, so you don't have to take that many notes. So if you're available to join us this afternoon at 4 o'clock, we'd love to see you. And otherwise, have a great week, and we'll see you back next Thursday. Harold, muchísimas gracias. Thank you so much for being here today.
De nada. Thank you, everyone. Have a great day.